So how did I roll it out? So how did I roll out across a health system this message? So once I got it, that I went, wait a minute, CAPC membership is not just for one, but for an entire hospital. You have to share that wealth. You have to share that message. So I basically went door to door. Trinity Health is a very open, relationship-centered company. I went to the C-suite. And I went to the chief medical officer. I went to the chief nursing officer. I went to our chief population officer. I went to our executive of the physician offices. And I said, I have something to share with you. And I told them about CAPC membership. And they stopped and they said, what a great gift. And with a great gift, they said, is great responsibility. Let's roll this out. Because if you're saying it is free to everybody, how could not we give this to everybody? And so we sat down and went through all the education curriculum. And it was about how they connected, of how it helps them. And then on a larger scale, they said, what is the universal need? What's the ripple effect? What are we all looking for in the human experience? And that's the relief of suffering. And on a corporate level, that can be measured in many different ways. And universally, what is that? The HCAP score. It's public reporting. It's pain management. So every hospital has to report on pain management scores. And they said, wait a minute, if this is a universal need of every patient, it's publicly reported, and all of our staff contribute to the relief of suffering, that's where CAPC membership can help. That's where the pain modules can help. That's where the communication modules can help. And so what they said was, so thinking that we have all these resources in CAPC and we can focus them on one universal goal that connects everybody, we can do this. Instead of scattering all these efforts, let's do it that way because it touches us all. And so that's how we did it. So the system-wide goal was identified to really improve the patient experience, the health system people-centered priority, and to relieve suffering. And it's part of our measurement. And so that's what we're doing. So what happened was that at national conferences, that at management meetings, at operations meetings, no matter where that message can be heard, that message was given and rolled out. It's also in our residency programs too, which is also really wonderful. All the residency programs, because we know it's a national need of education and our doctors and our nurses. So they knew to fill that need also. So as I went door to door and I said, what is your universal need? They all agreed. It's for the HCAP scores. And they said, let's affect pain and suffering. And let's do it everybody's job because everybody touches that patient. So that's how we identified our goal.